even in the subclinical stage, detection and early diagnosis. And then, of course, once it's diagnosed and the disease is progressing, we can still do a lot of things to reduce the damage in the joint. All right, so the recommended core treatment and the non-surgical arthritis treatment listed very nicely in a Journal of Rheumatology. They kind of grouped into 3 factors. Basically, in short, they're looking at the biopsychosocial model of care, looking at the predisposing factors, whether it would be age, sex, and we know females are more prone, education level, employment, and income. All those do play a role and a prognostic factor in the treatment of osteoarthritis. Lowering the educational level is so important so we can educate our patients accordingly, come down to their level and teach them the management of arthritis. The next box is enabling factors. What are the social constraints the patient has to live with, and see if there is any modification which we can recommend. And the need factors are basically the biofactors, where we can address the pain, physical function. Is there any coping mechanism where the patient has fear avoidance and we are trying to encourage them as coaches, and also to address BMI. So those kind of fall into the category of biopsychosocial model of care. And then, as you can see, a vicious cycle of arthritis, and the whole goal is to break that cycle. So the best practice guidelines for osteoarthritis, as you can see from yellow going down to orange, is basically starting with the first core first-line treatment, and it always starts with education. So education, self-management tools, exercises, weight loss or weight maintenance are the primary or the core first-line treatments. As the patient develops progressively in arthritis, there are other ways we can use is this non-pharmacological therapies, which we as therapists make a huge role. And the other is pharmacological, and it can be used in conjunction in mild to moderate arthritis. And when the arthritis really progresses, the gold standard is joint replacement. And then again, our role doesn't end there. We still educate our patient, we still make our patients strong and mobile, and then rehab them back to their functional activities. So in short, physical therapy has a big spectrum, and arthritis is our area, our expertise, and we should own it from prevention to treatment. So let's talk a little bit about education. And I think our treatment really starts with education, ends with education, as you can see in your daily practice. Education is so important, and basically it has to come down to patient's level. The patient should understand what is going on with his disease, how he or she can manage, and what is the prognosis for this. Using words of encouragement is very important. If we as therapists or as providers use scary terms like wear and tear, damage, it's bone on bone, that produces that fear avoidance behavior. And as we know, patients go into the rut. As you can see the left side of the curve, they perceive pain, they have threat of perception of more pain, more fear avoidance, and that leads to disuse, disability, and depression. But on the other hand, we as providers address the pain experience, give them encouraging word, make a low fear, confront the pain with the right modalities, and encourage exercises and recovery. That makes the person look at arthritis in a whole different ways. So education in that aspect goes along step by step in each and every state. Addressing the misconceptions, which is patients think that, oh, if I go for a walk, I'm going to damage my joints more. Or if I bike, maybe it's going to rub on the joint more. But we as therapists have to make a rational decision and give them clinical reasoning why you're doing certain exercise and what it will do for you. So education in those aspects is important. And the last but not the least is educating the patient that this is not a single event of therapy. It's going to be an ongoing management. Just like any other chronic diseases like hypertension, diabetes, it has to be managed. And so does arthritis has to be managed since it's a chronic disease. So we as therapists can think about ourselves as coach. We are coaching positive behavioral changes because the big part of arthritis is lifestyle, deficits in lifestyle. So when the patient comes with that in really early stages of arthritis, education is key. We give them the ways they can control their progression. Community-based programs are great. Community self-management education programs, which is highly, highly available online and offline. And again, remote programs are great in this pandemic situation where they can log in and still get the advice needed from a professional. Let's dive deeper into exercise, which is our zone, and we do that so often. Exercise in case of arthritis really is the key. It is one of the core treatment strategy, and it has to be properly prescribed according to the stage the patient comes in, the severity the patient comes in, age, and comorbidities. So that's where our expertise come in. We choose the type, repetitions, sets, frequency, duration, what could be the allowed changes or modification in the exercises, And again, education, giving the pain guide. I usually give the traffic light analogy to my patients. Most of these arthritic patients will start some range of motion exercises, and they would be painful for the first 5 or 6 repetition. But then it gets better as they go from a few more repetitions. So you have to give that analogy of traffic light. If the pain gets better over a period of time as the repetition increases, it's a green light. Go ahead with that exercise. If you feel the exercise and the pain are kind of remaining the same, there's no change, proceed with caution. Keep a good eye. Be in tune with your body and see if the exercise is working for you. And the red light is, of course, if the exercise is making more pain and it is getting worse with repetition, I would consider as a red light. Stop it, get back to your professional and discuss about it. Maybe the form was not right, or it was just the not right exercise for that patient. So exercise in general should not only address the local, but the global muscle in order to strengthen the whole kinetic chain. Balance and proprioceptive exercises, especially when dealing with the lower extremity arthritis, and just general aerobic fitness. Some studies have found the recommended everyday activities versus exercise when we see that people with arthritis are just not getting enough aerobic exercise or even muscle strengthening exercise as compared to non-arthritic population. Keeping that in mind and being aware what are the barriers and how we can address those potential barriers to physical activities, and also potential pain and psychological distress is one of our key addressing factors. So the 7 key recommendation I would say for the exercises is definitely you are tailoring each and every exercise according to the patient's need and preferences. You have to meet where the patients are. You cannot give him high or exercises which the patient will not do it. I usually come down to the patient's level and see, okay, what all equipments do you have at home? What do you think will work for you? Does activity work for you or exercise work for you? See what their preferences are and what they really value in their life. Consider water exercises, and if water is not available, use lawn weight bearing exercises initially if it is a very acute joint you're dealing with, and then accordingly progress to land-based exercises. Studies have found if there is mild to moderate arthritis or even beyond that, supervised exercise therapy over a 6 weeks period is often very, very helpful to get the patient started. What you're doing in that 6 weeks or even 12 weeks of supervised therapy is you're developing a change in lifestyle, you're developing a change in habits. And it's a good idea, maybe once a week or maybe twice a week or maybe 3 times a week, depending on your patient, you are having supervised sessions. It's important, and many studies have seen the benefits of booster sessions. Since arthritis is such a chronic disease, just 12 weeks of supervised program and then you say the patient you're on your own doesn't really work long term. So many studies have seen if you call the patient after 6 months or even after a year, check on them, it has a better long-term benefits, better management for arthritis. Encouraging low impact activities and developing a very safe and doable home program is such a key to arthritis. I usually give my patients some home exercise program, which I know they will do it because they have incorporated those exercises in their activities. And usually the idea behind is as you brush your teeth, as you maintain your teeth, you're going to maintain your joints and your muscles in your body. And that analogy really resonates with most of the patients. Like, yeah, I need to take care as a long term and just not forget when the therapy is finished. Last but not the least, especially with arthritic patients, we have to educate them about the flare-ups because we know arthritis goes in waves. There would be flare-ups, and how do the patients manage that acute flare-up and pain and modify their activities or their exercises accordingly is so crucial in overall management. All right, the next area for therapy is manual therapy. And manual therapy, we have seen over and over again, it's very, very beneficial, especially in cases of arthritis when we are dealing with mild to moderate, when there is involvement of capsule, we see capsular pattern of tightness. Manual therapy has proven very, very effective to get the pain reduction and also improve function and mobility. 3 paradigms which really work with manual therapy is physiological changes, biomechanical and physical changes, and psychological changes. These can include joint mobilization, joint manipulation, soft tissue work, muscle energy. So whatever your technique is and whatever the tissue is involved, we can use our manual therapy techniques. Next is activity modification, and this is one of the key domain of treatments for arthritis. Switching from a high impact to low impact, especially when it involves the weight bearing joints. And studies have found activity modification with the goal of keeping pain-free activities is really, really beneficial. Basically, we are looking at joint protection and further damage to the joint. That doesn't mean the patient doesn't do any activities. They just modify their activities in order to gain muscle strength, but produce less joint damage. And as you can see, there's a couple of pictures out there. Posturing is another thing which we have to recognize, just not for knee and hip arthritis, but the spinal arthritis, proper management of posture, which would help to alleviate pain and improve function. This is a big part we have to address, and this is one of the, again, core management of arthritis. And we all struggle with that. With our changing lifestyle, increasing in technology, we do struggle with this. But we have to keep in mind, weight loss is such a key component, especially in arthritic joints, that it cannot be ignored. So proper use of words to educate the patient, without making them feel too rejected or depressed about their body structure. We have to provide them counseling as a part of their exercise routine. Choose safe activities that are not detrimental to the joints, but also provide some weight loss to them. And usually studies have found people who have BMI more than 25 or more, a weight loss program has been very effective in decreasing pain and improving function. Electrotherapy, definitely not a core treatment plan strategy for arthritis, but definitely can be used in conjunction for pain management, specifically ultrasound for knee arthritis has had some value to it in short term, but again, it has to be combined or married with manual therapy if needed and exercise routine, weight loss. So you can think about electrotherapy as pain management modalities. Looking at thermotherapy, which we routinely do, heat versus cold. Again, knowing when to use what. So usually if it is an acute joint, I tend to use cold therapy, or if there's an acute flare-up, cold therapy usually helps. But if it's a chronic condition, more hypomobile condition, heat tends to work better for relaxation of tissues. Aids and devices, you all are very familiar with it. Short-term use of any bracing, joint supports, or using supports while doing activities, all have been shown beneficial. Again, these are supportive treatment strategies, but the core treatment strategies of exercise, alignment, weight reduction, lifestyle changes remain the key component of it. Taping, I don't know how many of you do it. I usually have had good success for short-term pain management. It is, you're taking the patient off the hump of pain, helping them to tolerate exercises better, and taping has been useful in short-term treatment as an adjunct to exercise program. Supportive shoe, definitely as a part of core treatment, especially if it involves knee and hip. Use shoes which are not only supportive, but more aligning with the kinetic chain and also shock absorbing. There is mixed reviews about the lateral wedges, but overall in early arthritis, our supports have been found kind of beneficial and of value. So looking at, this is a very good study and kind of exciting in the new journal, which kind of compared physical therapy with corticosteroid injections. They divided the patient population and they measured the WOMAC score after a year. And you can see the conclusion. Patients who went PT had less pain and disability at 1 year than who received corticosteroid injection. Very well said. And we can see as application of the core treatment, if you have patients undergo physical therapy, they do perform better. All right, so we look at different strategies. It's just an overview, but our role doesn't really end there. Our role is to follow up and review. Review at regular pace with people with symptomatic OA is important because they need that coaching at regular interval. Review of effectiveness and tolerability of all treatments. See where the exercises are going. Are they getting too easy? If they're getting too easy, the patient might just stop. Or are they ready to be transitioned to some global activities like biking or walking program or a group program? You can think about variation to that and see how their symptomatology is going. And 6 monthly follow-up, as said before, to core treatment like exercise and weight management has been really found effective. So what's the prognosis of arthritis? As we know, the course is really, really variable. Some people get worse really fast, some are stable, and some are better functioning. So it's such a highly individualized disease that we have to keep a regular check on these patients and always give a positive hope that he might be or she might be a person who would be stable and better functioning. Really, the progression of OA really depends on the individual and the comorbidities. And the take-home message is we play an important role in arthritis, and it can be very well managed with PT in conjunction with our medical team. With that, I'd like to thank you all for your kind attention. I have my contact over there. Feel free to email me with any questions or comments. I'm open to taking any comments. And I would like to just leave with a general thought for everyone, as we are doing today, just not for our patients, and also as a common PT group, that coming together is a beginning. Keeping together is progress, and working together is success. So thank you so much for your kind attention.
Thank you so much, ma'am. Thanks a lot for this insight on arthritis and the way you have explained all the processes during whatever happens during arthritis. We were able to get an insight of how the prognosis works and what to do in case of such conditions are prevailing. So I thank you again, and I request Dr. Ganveer ma'am to present you with a trophy, with a memento, a small souvenir that you presented the topic on this eve.
Well, thank you very much, Shraddhanjali.
Ma'am?
Oh.
Ganveer ma'am? There must be an interruption with the network. I am so sorry.
No worries. Well, I thank you all so much for joining in. It's just really exciting to see such a great number join in. I will stick around for any questions you might have.
Yes, I would request anybody to put up their questions if there are. So, ma'am, I would like to know actually from you that what is the perspective of the patient there in your country, and what do you think lacks here in India in terms of arthritis? So, is it the patient knowledge about arthritis, or how does he deal with the disease?
Well, I think the general presentation over here is, I think the human nature is very similar. What I have seen when I was in India, 20 plus years back, and here now, the basic patient psychic is pretty much the same. They need education, they need guidance, they need coaching in that. And there's always a big amount of fear, especially when it comes to spinal arthritis, or even peripheral joint arthritis. They're scared, they're genuinely scared, and they need help. So my perspective is that education has been the key component of treatment. They need guidance. Why are we doing this? What makes it better? How do I manage these symptoms? And the take home is they have to manage it. So we have to bring them as a team member. We have to work together with the patient and just not tell them what to do. If you do just one-way traffic, it just usually ends up not working well.
Thank you so much, ma'am. We have Dr. Swarna Ganveer, ma'am. She will be presenting you with a small souvenir.
Thank you.
Thank you so much, Preeti.
Thank you, Savarna. It's very good to see you there, and I'm very proud of you and Dr. Ganveer for you both doing great job there.
Thank you so much for joining, and thank you so much for enlightening us participants. Thank you.
My pleasure.
And
My pleasure. All right.
We'll deliver it whenever you come here.
Okay, sounds like a plan. Thank you so much.
Thank
Thank you for having me. And I wish everyone a great day ahead.
Thank you.
Thank you, madam.
Thank you.
Preeti madam, just I request one request from you, madam. Can
Sure.
we have one screenshot all together? We can ask everyone to open their video and we can have one screenshot along with you, madam.
Oh, absolutely.
Done, done. Thank you so much, madam.
You're welcome. It's very exciting to be here and see
Yeah,
such a
done.
good turnover.
Yeah, thank you.
Thank you.
Thank you so much, participants as well. After 10 minutes, we are going to start with the inaugural function with the chief guest coming in. So we would request you to give a pause of 10 minutes and then rejoin. Thank you.
Thank you, everybody. Good night and good day.
Thank you.
Jasa, good morning.
Good morning, sir. How are you?
Yeah, fine, sir. How are you?
All well, all well.
Good morning once again. Research conferences are aiming at the promising researches done by the young minds and talented academicians. Good morning to one and all. I welcome our chief guest, Honorable Dr. Sanjeev Jha sir. Dr. Sanjeev Jha sir has been in teaching and clinical experiences since 21 years. He has a master's in sports PT and is certified in manual therapy for Curtin University. He has been felicitated with Young Achievement Award, the Best Academician, and a Lifetime Achievement Award by IAP in 2016. I also welcome Dr. Ruchi Varshane as the National Head IAPWC. I welcome our organizing chairman, Dr. Shyam Ganveer sir. With his constant support, we have been able to come up this far. I also welcome Dr. Suvarna Ganveer ma'am as HOD and Professor DBVPF College of Physiotherapy. Dr. Ujjwal Yole sir, President IAP Maharashtra State. I, Dr. Shwetanjali Bhagra from DVVPF College of Physiotherapy, on behalf of the organizing team, the registration team and the scientific team, welcome you all to this event. Now I hand over the mic to our organizing secretary, Dr. Deepak Anap sir.
Thank you very much, Dr. Shwetanjali. Am I audible?
Yes, sir.
Dr. Deepak Anap, Organizing Secretary of this National Conference on Arthritis 2021. It's my pleasure to welcome you all for this first unique conference with the theme of arthritis. I wholeheartedly welcome all the participants across the country and also from abroad. We are fortunate enough to get a support from Indian Association of Physiotherapists, Indian Association of Physiotherapists Women's Cell. Today's conference has about 245 participants participating from more than 28 physiotherapy institutes across the India and also from abroad. I am happy to share with you all that we have received the delegates from US, Canada, making arthritis as a global issue of concern. We have experts from across the physiotherapy field who will be sharing their thoughts, knowledge, and opinions with the rest of us. We have chosen the expert speakers from India and abroad with core area of work in arthritis physiotherapy. We are managed to receive around 269 papers with the topic on arthritis. Paper presentations will be conducted under three categories, that is teacher and PhD, PG and UGIC category. I am happy to share with the presenters that we'll be honoring the first winner in each category with cash prize of rupees 3,000, memento and certificate, and second winner with rupees 1,500 memento and certificate. Also, the base paper in the categories will be published in WIMS Journal of Physical Therapy which is our own institute journal indexed in various indexing agencies. All abstracts will be published in special issue with ISSN number. I would like to conclude my welcome speech by encouraging the delegates to participate with an increasing number in all the lectures and discussions through this digital platform. Thank you very much. Shwetanjali, over to you.
Thank you so much, sir. Once again, I request Dr. Shyam Ganveer sir to speak a few words as the organizing chairman.
A very good morning to our President, IIP, Dr. Ruchi Madam, IIPWC Head, and all the delegates and my team members. Sir, I want to tell you that this National Conference of Arthritis we have planned for our as an academic program for the students, for PhD scholar, as well as for the academician, from where we got the participant from the national as well as from the international few of them. Apart from this, as the theme said that start today for better tomorrow on the Arthritis Day, but we started this program 1 month back under the Yojana of Rashtriya Vayashri Yojana on the occasion of India's 75th years of independence and the birthday of our Honorable Prime Minister Sri Narendra Modi ji. And under the leadership of our Chief Executive Officer, Dr. Honorable Sujay Vike Patil sir, who is the Member of Parliament. He's a neurosurgeon, and he took the initiative how the people in and around of Ahmednagar district should get benefited by this Yojana. Under this Yojana, we have covered almost 2 lakhs of population, where we distributed free appliances, hearing aids, and the motorized wheelchair to the person who are above the age of 60. And this is the wonderful job our management has took initiative and to create the awareness among the people about this arthritis. Along with this, what we have planned to run this program not only for the 1 month, but it will run throughout the year. And this program will be managed by our own institute. There will be no finance from the other, and this will be managed only by our institute. This was the greatness of our management under the leadership of our Honorable Sujay Vike Patil sir. And I also thanks to this organization like association IIP as well as the IIPWC and the Ahmednagar branch as well as the state branch, who has come together to make this event more successful. And I think this is an historic event where all these 4 associations are coming together to make this academic program more wonderful and more innovative and more knowledgeable to all these students. And this can be done only under the guidance of our IIP President, Dr. Sanju Jha sir, and the IIPWC head, Ruchi Madam, as well as the other person who was directly, indirectly involved in this, making the event successfully. So once again, I welcome you all, and thank you so much for giving me a chance to say a few words on this occasion.
Thank you so much. Thank you so much, sir, for your kind words. Now I request our Honorable Chief Guest, Dr. Sanjeev Jha, sir, to speak a few words.
Thank you, Dr. Swetanjali, Dr. Deepak, for hosting this wonderful conference. And it is always a pleasure to be among you and you people. And I'm very much astonished that how Dr. Shyam, Dr. Suvarna and the management manages so many activities all across the year. And it is so difficult, I know, because I am into administration, I run colleges, I run this great association of physiotherapy. So I can see the dedication and the strong zeal to excel and a strong zeal to work for the profession. And I really congratulate College of Physiotherapy Ahmednagar, IAP Ahmednagar branch, and all the team, including the great visionary person, Dr. V.K. Patil sir, for running the show with such a enthusiasm. And I can see, I feel that in last almost this in difficult time of Corona also, I have personally participated at least in 3-4 programs of this college. So it's really remarkable, and hats off to all of you, to the whole team. And it's indeed a great pleasure to know that you people are celebrating World Arthritis Day, and on this day you are organizing this nice conference. You know, physiotherapy few years back down the line, 2 decades back, we used to say that it is limited to back pain, limited to this, limited to that. But now organizing such a different conferences with different concept, with different topics, I'm very sure that very purpose of these type of conferences and events are to reach to number one, to patient, and number two, to all the professionals who are directly or indirectly related with physiotherapy profession. I feel as a professional, talk about when you talk about something on arthritis, early diagnosis and early physiotherapy intervention is very important. And usually we have a perception that arthritis means there is a swelling, there is something which is inflammatory in nature, and maybe physiotherapists are going to take the responsibility afterwards, but it's not that case. And I know that these 69 research papers, all the deliberations and all the invited talks on this particular topic will be very fruitful for all physios. And I'm very sure that active lifestyle of the patient along with physiotherapy will always change and keep the patient moving. And that's what is the core of doing anything in arthritis. So once again, I can say that we should have the perspective of patient saying this, yes, I can. And when I'm saying that the patient saying this is, yes, I can, physiotherapist has got a great responsibility and a great working background on which the patient is able to say, yes, I can. And this, yes, I can, should have the motto of everyone who is targeting or who is seeing the patient of arthritis. I really congratulate even the Maharashtra branch and Dr. Ujjwal for coming down here and sharing their good all gestures for IAP Maharashtra, from the side of IAP Maharashtra branch. And really very happy to see that all of you are doing such a wonderful job. Again, a big congratulations from my side, from the Central IAP and from the Central IAP team to Dr. V.K. Patil sir. And one day I will definitely try to visit your college and try to take some positivity from you people. And really, big congratulations and heart-filling happiness from my side to all of you, to Syam sir, to Suvarna ma'am, and to Maharashtra state team, and to Ahmednagar branch. Thanks a lot for inviting me here. And I hope this conference will be a very fruitful one. As Syam sir was saying, for another 1 year, he is going to conduct all these programs. I know that your hard work will not only take away the pains from the patient, but it will also reach to the heart of the patient, and patient will remember physiotherapy and you people as a person, messenger from God who can take away pain. Thanks a lot for inviting me here. Thank you. Thanks a lot.
Thank you, sir. Thank you so much.
Thank you so much, sir. Good morning to all the respected dignitaries and delegates present over here. On the behalf of Musculoskeletal Department of Dr. V.K. Patil College of Physiotherapy, Ahmednagar, Maharashtra, would like to propose the vote of thanks. It gives me immense pleasure to deliver the vote of thanks for this event to all the dignitaries assembled over here. I would like to thank our chief guest, Dr. Sanjeev Jha sir, IAP president, who honored this function with inspirational thought. Thank you so much, sir. I would like to thank our chief guest. I would also like to extend my heartfelt thanks to the pillar of this institute, Dr. Sham Ganvi sir, for his constant encouragement, support, and guidance. I would like to thank Dr. Abhijit Dute sir, Deputy Director of Dr. Vithala Vike Patil Foundation, for permitting us to conduct the event of National Conference on Arthritis Day 2021 and make it successful. I would like to thank Dr. Suvarna Ganvi ma'am, the State Coordinator of IIP Women's Cell, Ahmednagar District, for her valuable contribution. She has been the pillar of support throughout the process of coordination and confirmation of this conference. It gives me great honor to extend my sincere thanks to Dr. Deepak Anap sir, who highlighted the direction for taking this national conference to a greater height. I would like to thank Dr. Shwetanjali ma'am, who went an extra mile and worked really hard to make this event possible. I would like to thank all the teaching and non-teaching staff of Dr. Vithala Vike Patil College of Physiotherapy for their cooperation, and also the organizing committee member of the Department of Musculoskeletal Physiotherapy for their hard work. Thank you so much, everyone.
Thank you.
Thank you. Can you request, sir, to get one screenshot with all the videos?
Yes, yes.
Yeah.
Sure, sir.
You request to chief guest, sir, our Sanju Jha, sir.
So after the vote of thanks of the inaugural ceremony, we would like to start with the rest of the lectures that we have assigned for today morning. The next lecture will be starting in next 10 minutes. I request everyone to join at 10:30 again. Can everybody hear me? I request everyone to rejoin at 10:30 a.m.
Yes, okay, ma'am. Okay.
Okay, thank you so much.
Five, 6, 7, 8, 9, 10. अभी ऐसे रख के स्ट्रेट करना, सीधा करो हाथ अपने, अभी करो, फोल्ड करो हाथ, 2, 3, 4, 5, 6, 7, 8, 9, 10.